Hello everyone, my name is Kat and I'm coming to you as Nurse Cat Pink to let you know a little bit about when it's time to stop breastfeeding. So if you're someone who is breastfeeding your baby and that may be pumping, maybe you're exclusively pumping or mostly giving them breast milk, or maybe you're putting them to the breast to feed them, maybe you're doing both. But you've been thinking lately, is this for me? Should I keep going? When is it time to stop? And I'm a lactation consultant. I've been a lactation consultant for about 10 years now. I've worked in homes, private homes with people. I've worked in hospitals in California, Connecticut. I've worked in outpatient clinics helping pediatric patients, so babies, mamas, twins, all types of situations. I've been in the NICU. So that's a little bit about me. I'm also a nurse practitioner. So I'm a women's health nurse practitioner, which means I studied at Yale for 3 years doing prenatal, postnatal, and women's lifespan health from when you get your first period till past menopause. Worked in breast cancer clinics, seeing folks at high risk for breast cancer, in oncology, and then I've worked at reproductive health clinics, and I'm also a family nurse practitioner. So I've done family health, seeing people of all genders from birth until death. So that's a little bit about me and where I'm coming from. One question I've gotten a lot from my lactating patients has been, Nurse Cat, when is it time to stop? I'm feeling XYZ and I think it's time to stop. And there's many, many, many reasons why people consider this. You might be considering this 2 days after your baby's born. So you just had baby, you're just got home from the hospital, or maybe you had a home birth, but you're a couple days in, or maybe a couple weeks in, and you're thinking, gosh, this is hard, or gosh, my baby maybe doesn't seem satisfied. Should I keep going? You may have done a ton of research when you were pregnant. Maybe you took childbirth classes, breastfeeding classes, you read all the books, you talked to people who are breastfeeding, or maybe you don't know a lot. Maybe you don't know anyone who breastfeeds, you haven't taken any classes, you haven't been able to read any books about it, and you're like, I don't really know much about it. And no matter where you fall on that spectrum, it's all okay. I think what I've seen is that people who have the least education or knowledge or information or support when they're pregnant tend to get kind of blindsided by breastfeeding and are the most likely to question early, should I keep doing this? Especially if there's like pain involved, right? Or if you're worried that your baby's not getting enough. You're a good parent and you're worried, and that makes sense. However, just know that it's really normal to think that your baby's not getting enough when they are. So that's when you want to refer to wet and dirty diapers. You know your baby's getting enough to eat in the beginning if they're pooping and peeing regularly. And there's charts to that your nurse, your lactation consultant, or your doctor or midwife gave you when you were discharged from the hospital. So hopefully you're tracking that in the first few weeks. So that's one way to tell. Babies crying a lot does not mean that they're hungry all the time. So the other reason that people think about stopping is pain, but also just like emotional discomfort or mental discomfort. We all have our own histories and backgrounds and feelings and perspectives about putting a baby onto our body to get fed, and it's not going to feel right for everyone. Some people love breastfeeding, or chest feeding as another term is, many different ways that they love it. Some people have mixed feelings. They're like, yeah, this is really cool and great in some ways. Other ways, it's really not for me, but I'll keep doing it. And other people feel like maybe they have memories of not good stuff that happened earlier in life that comes up when they're feeding their baby, and it feels really not good. But maybe they've had some pressure from self or from others or both to do the right thing for your baby, to give breast milk. And I think there's also your exhausted parent. So maybe you haven't slept you don't even remember when the last time you slept was, because pregnancy and then feeding a baby, caring for a baby, no matter how you feed the baby, is exhausting. Maybe you're like really tired, and maybe you're also feeling like hopeless and really sad, and you're constantly crying, and it's not just in the first week, it's like 3 weeks out or months out after you've had your baby, and you're still crying a lot, or you're still feeling really hopeless, or incredibly sleep deprived, or maybe you've even had like you've seen your own mind like see something that isn't there, or hear something that isn't there. So there's a spectrum of different things going on mentally or emotionally for every person after they have a baby, and it's different for everyone. Side note, if you have thoughts of hurting yourself or your baby, get help immediately. Like, call 911 if you notice that happening, and then definitely follow up with your care provider, because there is help for that, and it can be dangerous. I know you're not alone, and it's okay. Wherever you're at, it's okay. The other thing with that is, like, of course you would want to give up doing this extra task with your body of feeding if you're not feeling like your mental health is as robust as it used to be, or it could be. That's very valid. I think if you feel really, like, in your heart and your soul or in your mind, you feel super committed and you don't want to quit to breastfeeding or lactating, there are resources and there is help for you that can support you through it. And also know that you don't have to. If you don't feel like continuing to feed, you don't have to. Or if you want to cut down on the amount of milk you make, or the number of feeds you do, which are the same thing, by the way, the amount of feed or pumping you're doing automatically equals the amount of milk you're going to make. So the more you pump or feed, the more milk you make. The less you pump or feed, or the less frequently you do that, you will make less milk. Within a couple of days, it's going to go down. We'll make another video on that. But the other piece of feeling ready to stop and asking yourself, why am I in this place? What brought me here to even ask the question, should I stop? Maybe you need support. There is support available, whether that be your local in-person or local hospital's virtual, like, breastfeeding or lactation support specialist for one-on-one help, so lactation consultant. Like, we are nurses that are internationally certified and have to do a ton of work and jumping through hoops to get certified. Like, we know our stuff with breastfeeding and lactation. Like, if you can get that one-on-one help, which is often through a pediatric office or through your local, like, WIC office, if you use WIC, or like a state-funded medical support or prenatal support, they should have a group for you, or at least a consultant for you to help you. Or even a nurse that is, like, learning to become a lactation consultant. Many offices, like prenatal offices, midwife practices, OBGYN doctors, or pediatric practices will have this person. Or if you prefer to get more group help or like lay help, so people who aren't necessarily like an IBCLC, internationally board certified lactation consultant nurse, you can absolutely find groups or like meetups, online meetups, as the pandemic closes down at the time of this video, or at least wanes off for folks that are vaccinated. Meeting up in person can become a thing again, I'm sure. But the support, especially if it's not within your family, or if you don't have it from your partner, or it's not as strong as it could be from family or from partner. Like, if you don't have a mom or a sister who breastfed for a long time and made it through, and it was a positive or at least okay experience from them, and they can talk to you regularly about how that was. If you don't have that, and many of us don't, and it's really hard to keep breastfeeding if you don't have that, do seek support. Or if you're in a position where you don't want to get support, or you feel like you don't have time or energy, or it's not accessible to you, depending on what else is going on in life, or your income, or maybe you have 17 other children. Like, everyone has such a different life scenario, right? So if it doesn't work for you to get support, maybe that's something to accept, and just know that if you're really, really stubborn and committed to breastfeeding, you can still make it work without support. It's just, you're gonna have a harder time than people who do have it. And if you're like, no, I'm Nurse Kat, I'm gonna give up, I'm gonna stop, that's not bad. that's okay. Completely okay. Just affirm yourself that you maybe don't have all the support and resources or other things that people who do breastfeed for 6 months, a year, 2 years, that they have. And that's okay. It doesn't make you less of a mom, less of a person or a good woman or anything like that. Like, society will equate those two, but they are completely separate. You're still a great parent or a great mom, great woman, if you're in a place where you're like, I do need to stop, or I need to cut back on how much I'm breastfeeding, or the amount of milk I'm making. Some folks will have partners that start to feel like they're not getting enough time with the baby, or maybe even a little bit jealous of the time that mom and baby have. Or maybe, you're picking up on a vibe of like, partner doesn't like that you're lactating, or maybe they tell you that outright and they're uncomfortable with it, or they are making comments about how it's, maybe they're making comments where you're not feeling so good with those comments, or you're starting to feel bad about yourself or what your body's doing, or your relationship with your baby. And that there's different degrees of this that can happen with partners, but just know that what your body's doing is normal. If you want to be breastfeeding, that's completely normal and okay. And if anybody is making you feel uncomfortable about something you feel okay doing, like with your body, such as breastfeeding or lactating, that's on them. And I would just say, that's on them, and that's something they're gonna have to work through. And it's not something for you to make them feel better about. So drawing that healthy emotional boundary, which can take a while to get to, but you can get there if that's not already in place for you. But if you feel like perhaps just not safe, like your body's tense all the time and you're feeling afraid a lot of the time, or like wondering if your partner, like you're afraid of like, gosh, when's the next time he's gonna yell at me, or the next time he's gonna say a comment about what my breasts are like, or what they're doing, or maybe he might like slap me or hit me. Those are signs of like domestic violence, or another term for it would be abuse, whether it be physical, emotional, or spiritual. There's many different kinds, financial abuse, but if you're in that situation, and unfortunately for women, this does escalate in pregnancy and shortly thereafter. Domestic violence is the highest during that time. Don't ask me why. That's not for me to explain. I just know it's the case. So your safety is important. If you are not feeling emotionally, physically, sexually, financially, spiritually safe with your partner, do think about ways to keep yourself safe. And whatever that means for you, whether it's getting out, staying with somebody else, making sure you have all your important documents and some little cash set aside in a place that your partner doesn't know about for safety. Making yourself safe can look different ways. And if you're feeling like you would like to stay in the relationship, even though you're feeling bad with the partner, just know that wherever you're at is okay. Just keep yourself and your baby safe, and keep your eyes out on what's going on and how it feels. That's my spiel on that. Are you feeling like you're someone who's exhausted all your options for breastfeeding? So again, we're asking ourselves, why do I want to stop? Have you exhausted all your options? Like, you've been to a lactation consultant, you've taken the classes prenatally and after baby was here, you've pumped, you've breastfed, you've had tons of like sleepless nights, or wherever it may be. Everyone's limit is different. So wherever your limit is at, that's your limit. It doesn't have to be someone else's higher limit where they're like, I've breastfed triplets in the NICU 3 times a day for the past 90 days. Maybe that's not your limit. Maybe your limit is more like, I've been up once every night. My partner's getting up with my baby, but also getting up with my baby. I'm giving artificial milk formula and I'm giving my breast milk, but I can't do more than 1 feed a day. It's just, it doesn't fit in my schedule. It doesn't feel okay. Like physically, whatever your reason may be, just know everyone has different limits. Whatever your limit is at, that's okay. So especially this can happen when people feel like they've exhausted their options. It's like, I'm at my wit's end. I've done everything. I still don't feel like I'm making enough milk, or This doesn't feel right, or I still can't fit it into my schedule. I have to be back at work and it's just too stressful. Whatever it is, that's a good why. So maybe consider like writing down your top 3 reasons of why you're thinking of stopping, and just think on that. Give yourself an hour or a day, maybe while you're feeding or doing something else, to just marinate on that. And then it really helps to have a back and forth with someone else. I'll talk about more on that towards the end of the video, but to have one other person who's been through it and who knows kind of the science behind it, physically behind lactation and breastfeeding, but also mentally and emotionally behind what women and parents go through. Talking to someone like myself who's been a nurse, I've been a mom, I've breastfed with support from my lactation consultant mom. So like super privileged to be able to have that. Been through the feeling of giving up. And I know the science side, like an extensive Ivy League education and clinical practice in many different settings about how to help people work through this type of problem in a safe way that's going to be the best for you, your baby, and your family. So that's an aside. Number 2, when you're thinking about stopping breastfeeding, this kind of goes off of number 1, but you want to examine emotions or the logistics involved, ideally both. So thinking about, what things am I feeling around breastfeeding? What do I feel around the idea of stopping? And if you're someone like me who maybe doesn't like readily express, I'm feeling angry, I'm feeling sad, like you feel it more in your body, like I do. It could be processing of like you writing down or saying aloud, whichever way you process best or reflect best on yourself. You can look at like, how am I feeling in my body every time I feed? Do I feel like my shoulders are hunching up and I'm clenching my jaw and I'm like bearing through pain, like physical pain or mental pain, or I just feel really tense and I don't know why? That's something to note. That's good information. Maybe it's logistics. So examine the logistics involved when you're thinking about continuing feeding or continuing the amount of milk you're making now versus stopping or slowing down the amount of milk you're making intentionally. So the logistics for some people might be, how can I keep fitting in feeds? I know I have to go back to work in a week. I'm currently breastfeeding my baby 15 times a day because I have a newborn, and the kiddo likes to eat, and they gulp sometimes they snag. Sometimes it feels like they're always at the breast. Every baby's different. But can I realistically do this when I go back to work? Is there a place for me to pump to keep up my milk supply when I go back to work? Am I okay with my milk supply going down because I don't have the ability or desire to pump when I'm at work? So thinking about what is doable and for you in your day. Or maybe you're thinking, I want to stop breastfeeding, I want to stop lactating, I don't want to make any more milk, and I want this to happen soon. Give yourself at least a couple days that you have where you don't have to do other things, and you're ideally going to have support like from a partner or a family member, where you can let your body go through that. Because your body, if you were to quickly stop breastfeeding and you've been doing it a lot, you will have physical side effects. So there is a low risk of infection too. So when you're stopping and the breast, they will fill up with milk when they're full, and you want to stop the amount of milk you're making or slow it down, you have to not let any milk out. So no squeezing, no feeding, no pumping. The more you pump, squeeze, feed, like the more milk that leaves the body, the more you will make. So it's an uncomfortable couple days at least of reducing your milk supply or stopping it. And then you can get an infection if it's done really quickly. Everyone's different. Some people are susceptible to those infections, some are not. So just planning, like, is it okay if I have a few days where I can just put ice on my breast, maybe take an ibuprofen and go through this? Or is that not doable for me? Is it easier for me to just keep feeding? And there's some nuances there in that lactation information can give you. But number 3, plan how you will realistically continue or stop. So this feeds right into number 2 of thinking about emotions and logistics involved. So For example, if I was thinking about stopping breastfeeding, or let's say I wanted to cut my feeds from 12 pumping or feeding sessions a day down to 6, I would think, okay, what do I realistically need? I know that I need some support. So even if it's like texting or messaging with a nurse at my doctor's office twice a week, if I have that, I can get through it. As long as I have that access to information and someone to reassure me that what my baby's going through, what I'm going through is normal, that's enough for me. Other folks may need something different. So you may need, like, you may be super independent. You may just need yourself reassurance. So thinking about slowing down or quitting, you want to think like, okay, I'm going to commit to myself. I'm going to support myself no matter what the external world says, or my doctor says, or my baby's doctor says, or somebody else, my mom says. It's right for me to cut back or stop. So I'm committing to myself to support myself. So again, no matter where you're at, it's going to look different. Number 4, and this feeds right into what I was just talking about. Number 4 is you want to trust yourself. So in the decision you make, and I want everyone to be able to make this decision. So I've talked to so many women who their milk supply went down and they're devastated. They wanted to exclusively breastfeed, or they wanted to like 3/4 of the time be able to give their milk. But because they didn't have information, their milk supply went down because they didn't know that you have to pump or feed many times a day and throughout the night to truly keep a strong milk supply up. So circling back to point 4 of trusting yourself, trust that you're able to equip yourself with the information and support and resources you need. And most of all, trust your decision. So no matter what, even if the process doesn't look perfect, like if your baby's mad because they miss being at the breast, which can happen, like they might be fussier, or they might refuse a bottle. You want to, when you're feeling that mama heart tug of like, oh, my baby, or you're hearing, let's say you're like a partner really wanted you to breastfeed like really badly, and the partner might be saying something of like disappointment or something like that. You got to trust yourself in your decision, because ultimately, no matter what you decide, whether it's continuing where you're at with breastfeeding, or you decide that you're going to stick it out for 2 more days, and if you can't line up the support or resources from your pediatrician, then that's it. You're going to have to cut back or quit. Like, no matter what your decision is, trust that you're making the best decision for yourself, because nobody can make that decision for you. This is your body. It's something your body is doing. And no matter what any healthcare provider or friend, family member, forum, blog, YouTube says, it's ultimately about you and your decision. That's the most important. So trust yourself, and even if it means like you need to write an affirmation and put it on the wall, or put it on the home screen of your cell phone where it says like, I can trust myself, or I trust myself, or I'm making the right decision for me and my family. Give yourself those affirmations. No matter what you decide, just know that you're making the best decision for your baby. Because a mom who's always felt kind of ambivalent about breastfeeding, but felt pressured into it by her GYN or like by her midwife, and then still kind of hesitantly breastfeeding, or like 70% into it, 30% like, gosh, this is a lot. I don't like it. It's very painful despite all the help I've gotten from the lactation consultant. At that point, you got to trust yourself. I'm kind of rambling here, but I'm going to circle back and post more videos which elucidate what I'm saying. I'm kind of on a rant with these 5 points here, so thanks for bearing with me. Number 5, and this is one of the these are all important points. This could be the most important point though, is to consult a professional if you can. I cannot tell you how important that difference makes, especially if you don't have a friend or family member or partner, someone close to you who knows a lot about breastfeeding, especially like has been through it. So peer support, if you don't have, especially if you don't have someone like that to help coach you through this, talking to a professional or somebody who you don't know, like maybe with me or a different lactation consultant, just sitting down for 10 minutes, 20 minutes, maybe even an hour, sorting through your thoughts, feelings, emotions, and the logistics of what's been going on. Like, has your baby been gaining weight or losing weight? Is your baby, like, how is your baby doing? Is your baby healthy? Is your baby crying all the time? Other parts of that assessment that you do with a professional would be, what's home life like? What are you working? Ideally, it would be getting to know you a little bit. So I personally love to have an hour with my patients. I can get to know you even if we've never met before, even if I don't have any intake paperwork on you, nothing. I can get to know you in the first 10 or 15 minutes and throughout the visit. Then we can transition into like talking about medical history, surgical history, stuff that really can impact lactation. Side note, there's very few things that actually like bring down milk supply physically or surgery wise. There's unique situations people have surgically or medically where they truly cannot produce enough milk to the point they want to or their baby wants. That's rare. It's not common. That's just another side note. I'll make more videos on that, but consulting a professional and having a good amount of time with them gives you a connection. Like, you trust somebody you connect with. You trust somebody you build a relationship with, right? So again, that's why I love having an hour with my patients. That being said, depending on who you are in your situation, with your provider or with a coaching consultant person like me, you can spend like 15 minutes or 20 minutes and still get a lot out of it. So even a small amount of time is certainly better than nothing at all. So the support, so that mental, emotional, social side of things that all humans need to get through something hard. And I'm assuming breastfeeding has been hard for you because you're watching this video. It's, for many people, it's not hard. For many, it is, especially if you didn't get the prenatal education. And then the professional piece of like someone who works in the medical field of knowing, is your baby okay? Like, are they healthy? Are they not? And does that connect to the feeding? And then assessing your mental health, your emotional health, your physical health. What are you at risk for health-wise, and that type of thing. If you're a nurse or a doctor, nurse practitioner, or other health professional, acupuncturist, anybody who's interested in learning more about lactation, in the future, I'll be posting videos that are tailored towards health professionals too, because unfortunately, most health professionals, doctors, nurses, NPs, midwives, do not get lactation specific education in your training. It's just not there. Like, midwives and nursing students that get lucky enough to get an OB rotation might have some exposure, but it's usually pretty darn minimal. And obstetricians, I know, you know, in medical school, you didn't get this. You didn't get this in residency. Maybe you were really, really lucky and scored it or arranged it on your own on your side time. But family practice, this is just not something we get extensive education on. So I'll also be making videos for that. I'll be making videos about like, how does different types of surgeries impact lactation and feeding? How do babies' anatomy, like mouth anatomy, impact lactation and breastfeeding? I mean, just so many topics. About 8 years ago, I was regularly teaching breastfeeding classes. They were 2 hours long, and I feel like they gave people just a tiny peek into the wealth of information that like your lactation consultant has around how to breastfeed, how to do it comfortably, how to do it happily. And then there's that kind of secret side of talking to a professional that we don't advertise, but is really real, and a really real part of lives for many parents and many women, which is, I don't feel great about XYZ. Should I keep doing it? Like, I don't feel great about breastfeeding, or I'm beyond like concerned that my baby's getting enough. Like, I know my baby's getting enough. I know I don't have to go back to work. I can keep doing this. But part of me doesn't really want to, or I just want to talk to somebody about whether I want to or not. And speaking with a lactation consultant, like someone like myself, you're getting that integration of therapy. So I'm not a therapist, not a licensed mental health professional, but I've been doing women's health stuff for so long that a big piece of my work is mental and emotional relationship interaction, building your confidence, building your information, helping you emotionally process. That's just what it is in women's health and trans health, non-binary health. There's a lot of that. And then again, my mind is drawing a blank, but I'm sure I'm going to make a ton of other videos talking about this because it's my passion. And I want you all to have information. I want it to be free. And it will be, it's going to happen. It's going to be free. I'm going to be posting on YouTube. I'm going to get to posting on, probably on Instagram, Facebook, that type of thing, just to help broaden the audience of who gets exposure to this information. I feel like there's a ton of great information out there for women's health, breastfeeding, lactation, like a ton on YouTube and elsewhere. The unique thing you get with me, with that I feel like I can bring to the table that I'm like, why didn't I do this sooner? Is like, I've had the great Ivy League education, and not that that's necessary to be a great practitioner or a great assistant to women. It's absolutely not a prerequisite, but it's a cool piece that I bring to the table. And then being an IBCLC, so lactation consultant, and having done that for almost a decade now, I've done childbirth education, I've done midwifery training. I'm not a midwife, but I've done years of training. It wasn't for me, but delivered babies, like been through people through their labors, like the whole 9 yards for years. I'm a women's health nurse practitioner. I'm licensed in California and Oregon. I'm done RN lactation consulting in the hospital and elsewhere. So like, enough about me. Like, I'm also a family nurse practitioner. Like, I know how to take care of babies, but not to toot my own horn, but I'm realizing like I need to not keep this stuff a secret. I see all the connections between lifetime health, women's health, primary care, pediatrics, baby's health. I see all that. And it's a perspective a lot of other people don't get. And doctors, nurses, they do not have the time to sit down and share this with everyone. And I'm like, shoot, if I post on YouTube, we can explode this information. In the old days, women would sit around a fire, like tribes of people would sit around the fire, and their boobs would be out, their baby would be on their boob, and they'd be chatting, cooking, maybe hunting on the side. I mean, who knows? Women are amazing and have done a ton of stuff that I'm sure the history books haven't recorded. But like, the point here is that you would always see, growing up, since you were born, you would always see a baby on the boob. You look at your mom, you look at your cousin, you look at your friends or your mom's friends. Everyone's got a baby on the boob. And before birth control, there were a lot of babies being had. So like, your whole life you grew up seeing a baby on the teat. That makes a huge difference in your confidence in yourself feeding, in what you know about feeding when you're growing up with people constantly talking about it, when it's like just a part of life. Like, it's like scratching your nose, or like saying hello is feeding, like putting your baby on your body and feeding them. And that the fact that we don't have that in modern American society we've completely forgotten. Like, breastfeeding is not intuitive. Just like, so you know, the psychologic background of like women's health and lactation, like gender in many ways, it's not like inherently all biologic. It's a performance that you see people do. So like, we learn gender, we learn how to do gendered stuff. It's a thing that you do, that you see other people do, that you learn. And if anybody tells you that breastfeeding is like natural and like intuitive and you should just know how to do it, lie. Not true. And I'm not saying they're trying to lie to you. They're just misinformed. Like, breastfeeding is not a natural thing that you should just know how to do, hands down. That's like psychology. That's the way your mind and your body are. It just doesn't. What does happen is the milk coming out after a baby's born. That's natural, and it's not even intuitive. It just, your body just does it. like how your body like bleeds every month. If you have a uterus, your body just does it. And that's like with milk, but it only does that if after the birth, if 2 days after birth, the baby keeps going, or you have a pump and the milk is taken out after it comes in around day 2 or 3 postpartum. So after that, it's like a mechanical thing you have to keep up with. And I'll make videos about that, and there's resources out there to learn about that. But it's not like you just know how to put the baby on in a way that doesn't hurt. Absolutely not. It's gonna freaking hurt if you don't have help. And it's gonna keep hurting if you don't have help, or if you haven't watched a ton of breastfeeding educational videos, or at least had like in-depth instruction on how to put the baby onto the breast. Like it's gonna suck and be painful, and your milk supply is gonna go down if it hurts. Like the pain inhibits milk supply. So again, just circling back to point 5 of consulting a professional, aside from, and just a side note, and I'm putting this disclaimer everywhere, due to logistic and legal and other reasons, I'm not offering Nurse Cat Pink or like my videos up for you to make any type of medical decision for yourself or your baby. Please don't base any decisions you make just off of my videos, or if you and I end up talking like on Zoom or something, I will not ever be talking with you in the role of a nurse practitioner or even of a nurse. I will be, for logistics and legal reasons, I'm only going to be talking to you as a coach, like someone here to support you, like a lay person would or a peer would, or in the role of a lactation consultant. So I would not prescribe or anything like that. Lactation consultants are not restricted in the way that nurses and NPs are when it comes to doing like patient care versus coaching. So that being said, regardless of what I'm here for and what Nurse Cat Pink is about, you should be consulting your pediatrician, so your baby's doctor or nurse practitioner. And second most important, your own provider. So your OBGYN, postpartum provider, or your midwife, or your lactation consultant, or your primary care doctor. You should be talking to someone about all of this stuff. And I know that you get short visits with them. You may have like 3 minutes with them. They may be having a rough day. You may be having a rough day. Maybe you're so tired you can't even speak, and you're like, I don't know what's happening. I can't do this. It's hard to have a robust conversation, but it needs to be brought up. Like it's often not safe to not talk to a professional, whether that be even like if you are seeing a lay midwife, like even if it's not a licensed professional, somebody who just knows about how to keep your baby alive and healthy and how to keep you alive and healthy, that's the person you need to talk to, or people you need to talk to. There's many things you're not getting in this video, and you won't get just from other videos or blog posts of mine, that are nuances of like safety, health safety. It's just not possible to give it all in like this one-way format. It's a two-way street. That has to be a conversation to assess healthiness. And that type of thing. So please do not assume anything from my videos of like, oh, it's totally okay to stop doing this or to start doing this, especially when it comes to feeding your baby, because that's something you want to be really careful with about. Just to remind you, if your baby is pooping and peeing a lot, not so worried about the baby. As long as your baby is steadily gaining weight after 2 weeks of age, they lose weight at first, but they should start gaining weight no more than 2 weeks after they're born. As long as they keep going up that growth curve and someone's monitoring their weight on a periodic basis, you can probably assume that things are going okay and your baby's okay. But there's also instances where you just want to get them checked out. But as long as they're pooping and peeing and their weight is gradually going up after 2 weeks of life, they're probably not in any big danger. That's like a quick emergency room triage trick that we use. I've also done some pediatric emergency room work, teeny bit, but I've done it. So that's about it. This video is way longer than I thought it would be. I've only touched the surface of what we're gonna go into with other videos. So I will be narrowing it down. This was kind of a general 5 things to ask yourself if you're ready to stop breastfeeding, because I know it's a hot topic that a lot of lactation consultants, nurses, midwives, doctors don't talk about. And it's usually like once that decision is made, then we're scrambling to help you. But I want to catch you before you make that decision, because I know it's something you're thinking about or feeling, and you're feeling like you don't know who to trust to talk to about it. So I'm hoping that these videos, and I'll post on other things probably, so not just lactation, but also women's health topics, like deep, intimate stuff that you don't usually bring up with your provider unless they have a ton of time with you and you're able to trust them and you're able to build that relationship with them. I'm hoping that I can provide that. I know it drains my soul to have only 10 or 15 minutes with my patients, especially my patients of gender minorities, like women, trans folks, non-binary folks, because there's often a lot of stuff we need to process, we need to talk about, and you need to feel good when you leave